in these stores at the mall that we talked to her about. She spent very little time. There were no folks around her. She did go to the food court, ordered something to eat, went by herself and sat. So again, this is based on what history we've received from her, and we certainly want folks to come forward and let us know if they think they've been exposed, and we will be making a media notification regarding this, and this is exactly what we're doing now.
You're going to identify the mall as the North Star Mall. Why won't you guys identify the hotel? I mean, we know that other cities have identified hospitals where people are being cared for and that stuff, so in the interest of transparency, why are you not identifying the hotel?
Okay, so we did. Initially, we didn't come out and say the hotel because we needed to make sure the hotel is notified first. We are absolutely confident that the exposure within the hotel is pretty confined and contained. We had a chance to talk to the hotel officials late yesterday night. So at this time, we are releasing the name of the hotel. She stayed at the Holiday Inn at the airport.
There's 2 Holiday Inns in that area. Which Holiday Inn?
I have to get you the exact address for that. We will be sending that address out.
Doctor, you talked about sanitizing at the mall. Can you explain what you're asking the mall to do and what the mall will be doing?
It's regular routine wipe down with the disinfectants. Make sure you follow the EPA-approved disinfectant guidelines for cleaning. Pre-clean dirty surfaces with cleaners and water, and then use the disinfectant. So any high-touch surfaces, your doors, your doorknobs, your countertops, your food court tables, chairs, etc.
Who's doing this cleaning? Who's doing this cleaning?
We just had this conversation with the mall authorities, and those things have to be finalized.
Doctor, for those folks that have had contact with this woman, what's Metro Health's role in keeping tabs on these people? Are they going to be tested? Are they asked to be quarantined, self-quarantined? What happens?
So the low-risk folks, the guidance at this time is for them to be self-monitoring their symptoms twice daily and contact us promptly should they develop symptoms. The most important recommendation we give out is should you develop any sort of upper respiratory illnesses, please do not show up in our emergency rooms or in your doctor's offices without notifying us first. Once we get notified, the plan is for us to safely evaluate her and as much possible keep her away from keep her away out of the hospitals if she's medically stable.
Mayor, I know you mentioned this briefly about there's supposed to be a release of more of the evacuees. We've been here, I guess, 2 weeks in quarantine. Are they going to be released this week in light of what's happening?
So the CDC's plan was to release those who have gotten to the end of their quarantine period today. We have just received a letter from Dr. Hellerstadt at the state requesting a 3rd test. We totally agree with that. And we are right now communicating that with the state and the federal government. At the end of the day, we believe that they ought to be tested, and we need assurances from CDC that they would pose no additional risk to anyone in the public. And we're going to do everything within our local authority to make sure that no one is released until we have that assurance.
Who makes that call?
Right now, at this time, it's the CDC, the federal government. But we also know that state can help us with that, and if necessary, the local will too.
Mr. Mayor, do you think that the federal government has set up San Antonio to be ground zero for an outbreak of the coronavirus in the United States?
Well, I think the federal government should respond to the guidance from our local medical community. We had a quarantine mission that was quite contained. We also know that we've been requesting their response to guidance that we have had from the local community to help make sure that the risk to the public remains low. And that's what we're continuing to do right now. We know that the news lately over the last week has been coming from every corner of this country. And so what I think we ought to be doing is everything in our power at the county as well as the city to ensure we keep our public safe in the event that this becomes an outbreak. And that means we're dusting off and preparing our local pandemic plans, just as we did in the case of Ebola. That also means that everything is on the table to make sure that we protect the public, everything.
Do you have a sense, Governor, that the governor has the authority to do this? Does the governor himself does he have the legal power to keep them on base?
I believe, so we are in communication with the state and federal authority right now, as well as our local Metro Health District. Between the three of us, we will ensure that these folks are not released from quarantine until there's assurances that they pose no risk to the public. If that means it falls to the local authority to do that, we will do that.
How long will it take to get the results of the third test if it is administered as a whole? How long will it take to get those results, and at what point will that decision be made?
I'm sorry, could you repeat that, Jesse?
How soon do we expect to get the results of that third test, if as a whole,
Yeah.
will be administered? And what's then?
I'll defer to Metro Health on that. Thanks.
We've been receiving test results anywhere from 48 to 96, 72 to 96 hours back from CDC. But I've been assured by the CDC that there will be a priority put on these test results to come back to us in a timely manner.
If I can ask you plans community-wide, we've now had one person released who may possibly have spread this to other people, which means there could be, if someone is infected, their first contact would be going to a hospital or a clinic. What is being done citywide to monitor if there's any possible cases showing up at hospitals or clinics?
So we've been working closely, and this is not just recently. We've been working since the beginning of this COVID-19 incident. We've been working closely with our healthcare providers, with our EMS community, educating them on what signs and symptoms to look for, laying emphasis on asking the travel history, and if they deem out of abundance of caution, we've been asking all hospitals to make sure that masks are provided at the entrance, and also educating the community regarding using these masks before they enter. Should they have symptoms of upper respiratory illnesses, use masks prior to entering any healthcare facility.
So I'm not entirely clear on the answer I got earlier. If you had to total up the total number of people who've been exposed so far, what does that number come to?
So we know for a fact how many folks were involved in the healthcare facility, and we know for a fact how many folks were exposed in the Holiday Inn. It is not possible, or we're making every effort to identify any exposures at the mall, and based on what we have at this time, those exposures are pretty low risk exposures. We don't have numbers for that, yes.
What about transportation to and from these places?
She did use the hotel shuttle, and the shuttle drivers are one of those exposures identified, yes.
Doctor, when we came to this press conference today, I was meeting with my colleagues and many of the people who work for the city. We weren't shaking hands. We were doing the elbow bump or touching each other's feet. Do you think people should be doing that?
It's a good idea to do that. This is cough and flu. This is cold and flu season. We recommend that all the time, not just for COVID-19, for any upper respiratory illness seasons. We've been recommending, practice those everyday preventive measures if you don't have access to soap and water and good hand hygiene techniques.
Sig, let me answer your question, because I know there's a lot of questions about what happens with the folks that are scheduled to release today. We have been in contact with federal officials, both parties of our federal delegation, as of this morning. They both agree these folks need to be tested before they are released, so that they are deemed no risk to the public. We're going to ensure that that happens, okay? The federal government can do that very easily. The state government can do that as well. If that does not happen, we will ensure at the local level that those folks that are deemed not risk before they are released. Let me just make that very clear.
Mayor, do you have a number for the number that are set to be released tonight?
I believe it's 120.
That's right,
122.
Can you say how many isolation beds we have here in town? I'm interested in learning what the local capacity is for isolating patients at a wide scale if we were to have an outbreak here. Like how many isolation, negative pressure rooms do we have in town?
So I'm not clear of the hospital number. I know that we have 22 rooms at the Texas Center for Infectious Diseases, and if need be, the discussions are expanding that radius outside of San Antonio and looking at the metropolitan area and even in other places of the state. So I don't have a specific number for you. What we know to be true is that we have 22 rooms currently right now at TCID. They are, and so they're still recovering, and so we see that attrition rate occurring over the next several weeks. But I think again we know that to be true with TCID, and we're in the process of identifying all of those other capacity within the region and also the state.
So it's my understanding that a group of students are returning from UTSA are returning from Italy, and there's not necessarily a quarantine going to be on them. Italy has had a high number of cases. Are you all aware of what's being done as they return back home?
Yes, we're in contact with UTSA. Okay. Yeah, sure.
So, UTSA President Amy confirmed this morning that those folks, the students that had come back in consultation with Metro Health, will be self-quarantined off campus. And so also related to the previous question about the hospital capacity, we talked about Metro Health and the work that they've done. STRAC, which this city is gifted by, coordinates with 72 hospitals in the area. They deserve a lot of credit for the coordination of capacity in the event it's needed. But again, with respect to the question about UTSA, again, those students are being self-quarantined off campus.
Can we drill down a little bit here on the timeline? When did this woman at the hotel get on the shuttle and go to the mall? How long was she at the mall? What time period does that take place in on Saturday? Saturday afternoon, Saturday evening?
Yeah, it was Saturday evening, closer to 5:30 is when she entered the mall and exited the mall around 7:30ish.
What time?
7:30.
So she was there for about 2 hours?
For about 2 hours, yes. But she spent most of her time sitting at the food court by herself eating her Chinese.
Mr. Mayor, when we first had the coronavirus story come to San Antonio, there were certain people who were upset that people were brought to San Antonio to be in quarantine here. They were upset because they were concerned that these people and the virus was going to make its way off of Lackland and the quarantine and into our community. What do you say to those people?
Well, again, it's totally unacceptable that CDC would allow for a patient who had a test result come back positive to be released into the public. This is a quarantine mission, which we have the capacity to execute extraordinarily well in San Antonio and in a compassionate way, but it requires our state, federal administration partners to be working in coordination with us. This should not have happened. In the meantime, we have a local response to ensure that the threat to the public remains low. At this time, we'll go ahead and wrap up Q&A. Everyone up here, including council, is available to folks if they want to ask questions one-on-one. I do also know that we have a couple folks who are available to answer some questions in Spanish if there are needed Spanish language media outlets.
I just throw one in.
Yeah.
From the perspective of CDC, they would say they did everything the way they have done it, that they did it right. This third test that was done was a complete accident. They were not aware of it. Did they really do anything wrong here? They were following their procedures as they have been following them from the beginning.
The guidance of the medical community has been to ensure that all test results